Welcome to Lecto. Today we are going to discuss classification of hemolytic anemia. In hemolytic anemia, you will see increase in the rate of RBCs destruction. Normally, lifespan of RBCs is 120 days, and after that the RBC is destroyed by the different macrophages. But whenever the RBCs lifespan below 30 days, it means that the RBCs are destroying rapidly in our body. That ultimately causes the hemolytic anemia. So actually we categorize the hemolytic anemia into two categories, extravascular and intravascular, on the basis of the location where actually RBCs destroy in our body. So as the name indicates, extravascular mean outside the blood vessel. So specifically RBCs destroyed by the different macrophages. Macrophages exist in our body at different location in different organs like spleen, lungs, liver, kidney, and they form the reticuloendothelial system. Specifically, what type of system? Reticuloendothelial system. Okay, that is formed by the macrophages. Specifically, two most important organs that are actually involved in the destruction of the RBCs, that is the spleen and the liver. These are the important organs where RBCs destroy. Okay, and in intravascular you see the RBCs destroy in the blood vessel. So that's the most important thing. Okay, we again further categorize extravascular into two, intrinsic defect and the extrinsic defect. If there is a defect inside the RBCs, then it is called intrinsic, or you can say intracorpuscular. Intracorpuscular, or when there is a defect outside the RBCs, then you can say that is extracorpuscular. That's the most important thing. Okay. So, most important defect that is present inside the RBCs is the membrane defect. Defect of the RBCs membrane. So, in that situation, you see the two most important situation. First one is the hereditary spherocytosis, and second one is the hereditary elliptocytosis. Normally the shape of the RBCs is biconcave, but whenever the different proteins that actually maintain the cell membrane of the RBCs destroy, then you will see two most important situation: spherocytosis, in which the RBC shape becomes spherical, and in elliptocytosis the RBCs shape becomes ellipsoid shape. So that's the most important case. And ultimately, it's the normal rule. Whenever our body detect abnormal cases, abnormal RBCs, they will prefer to destroy these abnormal RBCs. So these abnormal RBCs actually destroyed by the reticuloendothelial system, or you can say macrophages that are actually present in the spleen and liver. So that is actually the extravascular hemolysis. Okay. Next is the enzyme defect. If there is a defect in enzyme, okay, that can also cause the extravascular hemolysis. G6PD glucose 6-phosphate dehydrogenase, that is the most important enzyme in the glycolytic pathway, and you can also see the pyruvate kinase deficiency. So now again, these are basically the enzyme defect, and ultimately macrophages destroy these RBCs, and that is actually extravascular hemolysis. Next is the hemoglobinopathy. If you see the defect in the hemoglobin, that's RBC is also abnormal, because as we know that the hemoglobin actually present in the RBCs. If there is a defect in hemoglobin, that it means that the RBC is actually defective. So you can say in the sickle cell anemia, or you can also say the thalassemia. In thalassemia, you will see the abnormal amount of the alpha and the beta globin chain, that is the part of the hemoglobin. Hemoglobin consists of alpha and the beta chains. Okay. Now they all fall in the extravascular hemolysis. When you see the defect, these are basically defect inside the RBCs. When we see the defect outside, that is called extrinsic defect. So first one is the immune mediated. Whenever you listen the word immune, it means that we are talking about antibodies. So in that situation, we categorize immune mediated into two. First one is the autoimmune, and second is the alloimmune. So in autoimmune, you will see the antibodies produced against the RBCs, and in allo, the antibodies comes outside the body. That's the most important thing. So in autoimmune, you can say that called autoimmune hemolytic anemia and the warm autoimmune hemolytic anemia. These are basically the two. Why do you call it called? Because in that situation, specific antibodies like IgM antibodies produced in this case against the RBCs. So if you see here is the RBCs. So in that situation, IgM. So IgM is actually the pentameric proteins, pentameric antibodies. They will attach to the RBCs, and ultimately you will see the destruction of the RBCs extravascularly. And you see worm, in case of worm you see the IgG, okay, that's again the antibodies, and it is actually the monomeric antibodies that will attach to the RBCs and cause the hemolysis. So they here are basically called autoimmune hemolytic anemia and warm autoimmune hemolytic anemia. Okay, that is actually auto. Antibodies produced against the our body's RBCs. In allo, you can see two situations. First is the hemolytic transfusion reaction. If wrong blood is transfused to the recipient, then you see the hemolytic transfusion reaction. Specifically, what type of delay type? That actually you can say after long period of transfusion. So that is hemolytic transfusion reaction. Okay, and you can also see the drug-induced hemolysis. Why? If you see here is the RBCs and drug attached to the RBCs, different drug, and antibodies against these drugs bind, and ultimately these RBCs will become opsonized, and macrophage can easily detect these RBCs and they will kill the RBCs, and ultimately you will see the extravascular hemolysis. So here are basically the different situation of extravascular hemolysis. If we see the intravascular hemolysis, that is actually inside the blood vessel. So first, if we discuss extravascular, source is outside the red blood cell. First is infection. Infection actually comes from outside. So there are different situations. You will see the intravascular hemolysis. First is the malaria. Okay, that's the most important thing. You can also see the tick-borne diseases like babesiosis, or you can say Clostridium bacteria. There are basically a lot of different situations in which you will see the hemolysis. In malaria, you can see the intravascular hemolysis, or you can also see the extravascular hemolysis as well. So here are basically the different situation about the malaria. Next is the microangiopathy. Micro means small, angio means blood vessel, pathy means defect. So it's mean that when there is a defect in the blood vessel, small blood vessel. So why actually blood vessel becomes small, or why defect exists in the blood vessel? Due to different situation like thrombus formation, DIC, disseminated intravascular coagulopathy, in which you will see the different clots formation in the body. Whenever the RBCs flow through this blood vessel, then this RBCs will destroy by the clot. So actually clot destroy the RBCs because RBC is very fragile. So when the RBC is destroyed, it will break down in the blood vessel, and that is actually the intravascular hemolysis that actually happens in the blood vessel. So this can also happens in the TTP, thrombotic thrombocytopenic purpura, and uremic syndrome. So here are basically the different situation. And you can also see the cardiac hemolysis. When you see the artificial heart valve, when the RBCs touch to the artificial heart valve, then the RBCs will breakdown. So this is actually the different situation that actually happens inside the blood vessel. Next is the burn. Whenever you see the skin burn, so in that situation, suddenly RBCs that are actually present or flowing in the blood vessel will start destroying. Okay, next is the drugs. There are certain drugs that cause the intravascular hemolysis. So in that situation, most important if you see is the sulfasalazine, that is actually used in the bowel inflammatory diseases, sulfasalazine. So that causes the intravascular hemolysis. Okay, that's the most important thing. And in some situation, when you see the when you provide the IV line to the patient, then in that situation, due to the osmotic balance, specifically what type of solution given through the IV line, specifically hypotonic. So what will happen? So in that situation, if there is a blood vessel, okay, this is the blood vessel, and in that situation this blood vessel has hypotonic solution, then what will happen? So here is the RBCs. The water that is actually present in the blood vessel starts flowing inside the cell, and the RBCs become swell and become ruptured because there is no cell wall that is actually support the RBCs. So RBCs suddenly rupture, and that causes the intravascular hemolysis due to hypotonic solution that is actually provided by the IV line. So that's the most important thing. And you can also see in the March hemoglobinuria. So again, that is actually most important is the March hemoglobinuria. You see the hemoglobin in the urine when you stand for or you walk or you do strenuous exercise. In that situation, you see the hemolysis of the RBCs, and that is March hemoglobinuria, and hemoglobin will be present in the urine. And next is the transfusion reaction, hemolytic transfusion reaction, but that will be the acute. In case of this was the delay hemolytic transfusion reaction, but in the intrinsic vascular hemolysis you will see the acute hemolytic transfusion reaction. And next is the immune mediated, specifically called autoimmune hemolytic anemia. So that's the most important thing. Cold immune hemolytic anemia can also be seen in intravascular hemolysis. And last is the intrinsic defect, when there is a defect inside the blood vessel, that is the paroxysmal nocturnal hemoglobinuria. So in that situation, you will see defect in the anchors. So actually you see the proteins, that is actually the glycosyl phosphatidylinositol, that actually present on the surface of the RBCs. If you see here, this is the RBCs, and that is glycosyl phosphatidylinositol is present. That will attach the different proteins like CD59 that actually prevent the reactive lysis. So if there is no glycosyl phosphatidylinositol, so there is no CD59, and ultimately this red blood cell is vulnerable to destruction in the intravascular. So that's the most important thing about the paroxysmal nocturnal hemoglobinuria. So this is all about the classification of hemolytic anemia. If you have any question, you may ask in the comment section. Thank you so much.